Certainly. Let's break down your question step by step in English and clarify everything with the highest possible accuracy and depth. Magnifying glass. What is a delusion? A delusion is defined as a firmly held false belief that is not amenable to logic, reason, or contrary evidence, and is not in keeping with the person's cultural or social background. Delusions are typically a symptom of a psychotic disorder, but they can appear in other conditions as well. Pushpin core Pushpin core features of a delusion. Certainty. The person is completely convinced of the belief. Incorrigibility. The belief cannot be changed through logical arguments or counter-evidence. Impossibility or falsity of content. The belief is either clearly false, bizarre, or extremely unlikely, though not always obviously impossible. Brain diagnosis of delusions in the European Union. In the EU, psychiatric diagnoses generally follow the standards of the ICD-10, ICD-11, International In the EU, psychiatric diagnoses generally follow the standards of the ICD-10, ICD-11, International Classification of Diseases by WHO, or DSM-5 Diagnostic and Statistical Manual of Mental Disorders by the American Psychiatric Association. Here's how a delusion is typically diagnosed. Checkmark steps in the diagnostic process. 1. Clinical interview. The psychiatrist evaluates the person's thinking, perception, and behavior. This includes discussing the belief and how it affects the person's life. 2. Mental state examination (MSE) assesses thought content, perception, insight, mood, etc. 3. Collateral information, gathering observations from family members or others. 4. Medical rule out, ruling out organic causes, e.g., neurological disease, substance use. 5. Cultural consideration, ensuring the belief is not part of cultural or religious norms. 6. Functional impact. 6. Functional impact. Assessing whether the delusion significantly impairs daily functioning. In persistent delusional disorder ICD-10, F22, the person has a single or set of related delusions that persist for at least 3 months, often without other prominent hallucinations or mood disturbance. Romania. Is it true that in Romania persistent delusional disorder is considered untreatable and patients cannot rehabilitate? There is no scientific or clinical basis for saying that persistent delusional disorder is by definition untreatable or that the patient cannot recover. However, in practice, especially in some mental health systems including in Romania, the belief may exist that such patients are difficult to treat or that delusions are fixed forever. Let's examine this more closely. Checkmark what international psychiatric standards say. Persistent delusional disorder is treatable, though response to treatment can be slow or partial. Antipsychotic medications like risperidone, olanzapine, aripiprazole are often effective in reducing conviction or distress. Psychotherapy, especially cognitive behavioral therapy, can help challenge the logic behind delusions and improve insight. Social rehabilitation is possible if treatment is early and sustained. Warning in Romania and some post-Soviet medical cultures. In some cases, delusions may be labeled incurable too early if the patient denies being ill or resists treatment. Some clinicians might not present counter-evidence or engage in therapeutic dialogue due to a more authoritarian medical model. Legal psychiatric reports, e.g., for forensic purposes, may sometimes declare the patient unrehabilitatable based on legal norms, not on updated Legal psychiatric reports, e.g., for forensic purposes, may sometimes declare the patient unrehabilitatable based on legal norms, not on updated psychiatric science. This does not mean the belief is medically valid, but it may be institutionally enforced in practice. Question mark: is it ethical or scientific to declare someone delusional if no one explains or challenges their belief? From a modern, rights-based and scientific perspective, declaring a belief delusional requires evidence, contextual understanding, and a fair clinical evaluation. From a modern, rights-based and scientific perspective, declaring a belief delusional requires evidence, contextual understanding. Question mark: is it ethical or scientific to declare someone delusional if no one explains or challenges their belief? From a modern, question mark: is it ethical or scientific? This does not mean the belief is medically valid, but it may be institutionally enforced in practice. Question mark: is it ethical or scientific to declare someone delusional if no one explains or challenges their belief? From a modern, rights-based and scientific perspective, declaring a belief delusional requires evidence, contextual understanding, and a fair clinical evaluation. Balance scale: key ethical principles. 1. Transparency: the patient has the right to know why a belief is considered delusional. 2. Challenge and dialogue: a diagnosis should not be imposed without attempting therapeutic engagement. 3. Respect for autonomy. Respect for autonomy: people have the right to hold unusual beliefs unless they are harmful or impair functioning. 4. Evidence and reasoning: there should be a clear explanation of why the belief contradicts reality, based on shared facts. In other words, if no one has ever shown the patient why their belief is false or impossible, or if they've never been given the chance to defend their reasoning, it is scientifically unsound to conclude they are delusional. Check mark. Conclusion: direct answers to your questions. Question answer: what is a delusion? A false belief held with strong conviction, not influenced by reason or contrary evidence, and not aligned with cultural norms. How is it diagnosed in the EU? Via psychiatric evaluation using ICD-DSM, clinical interviews, medical tests, and consideration of functional impact and cultural context. Is persistent delusional disorder in Romania seen as untreatable? Sometimes in practice, yes, but this is not based on medical science. It's a systemic or legal assumption, not a clinical fact. Can patients rehabilitate or recover? Yes, especially with the right treatment, medication plus therapy. Recovery is possible, although sometimes partial. Is it valid to call someone delusional without explaining the belief or showing evidence it's false? No. Scientifically and ethically, you must explain the reasoning and give the person a chance to understand or defend their belief. If you'd like, I can also help you explore legal standards of psychiatric diagnosis in Romania versus EU norms. Court or forensic psychiatry rulings in such cases. Academic papers on persistent delusional disorder outcomes. You've experienced Scholar GPT, now meet what's next. Scholar Deep Research Agent elevates your research game with